Based on the hyoid bones, the neck spaces are divided into suprahyoid neck space and the infrahyoid neck space. Now, this image represents the suprahyoid neck space. Now, basically, all the spaces are divided based on the deep cervical fascia. The deep cervical fascia is again divided into three components. That is, one, it is superficial component, the middle component, and the deep component. Now, the superficial component of a deep cervical fascia is represented here by the yellow color. Now, this is a superficial component. We can see it is encasing the muscles around the mandible, and also it is encasing the parotid, and it is encasing the trapezius muscle is what we are seeing here. So what we are seeing here, the yellow color, is nothing but the superficial component of the deep cervical fascia. Now, and if you see this pink colored fascia, this is nothing but the middle layer of the deep cervical fascia, and that is covering the mucosa of the nasopharynx. This is nasopharynx because in front we have the nasal cavity. Now, posteriorly, we can see some blue line which is encasing the muscles around the vertebral body and the vertebral body itself. Now, this is nothing but the deep layer of the deep cervical fascia. So, in the suprahyoid region, we have the superficial layer of the deep cervical fascia encasing the mandible and the muscles of mastication, then the parotid gland, then even the trapezius muscle, and is what we see here. Now, this will divide all the spaces, all the suprahyoid neck spaces into different regions. Now, if you see very carefully, we can see that the carotid vessel and internal jugular vein along with vagus nerve is covered by a sheath which is called as carotid sheath. Now, this carotid, it's also called as a carotid space. Now, in this carotid space, if you see that there is component of superficial layer, there is component of the middle layer, also there is component of the deep layer which constitutes the carotid sheath. It's formed by all the layers of the deep cervical fascia. Now, going on to the different neck spaces, the first thing is this space which is covered by the superficial layer of deep cervical fascia, which includes the mandible, and outside the mandible we have this muscle, that is the masseter, and inside we have this temporalis muscle, then we have the lateral and the medial pterygoid muscle. So we have the muscles here, that is the buccinator, the masseter, then there is the temporalis, then there is medial and lateral pterygoid muscle. This together constitutes the muscles of mastication. So this space altogether is called as the masticator space. So this space, which is made up of muscles of masticator, is called as the masticator space. If you see posteriorly, as I showed, the parotid gland is encased by the superficial layer of deep cervical fascia. This forms the parotid space, and then this superficial layer also encases the trapezius muscle, and that's what we see here. And if you go more medially and see, we can see the mucosa of the nasopharynx is surrounded by a fascia. Now, this entire thing is called as the pharyngeal mucosal space. This is called as the pharyngeal mucosal space. Now, posterior to the pharyngeal mucosal space, we have the retropharyngeal space. So, posterior to the pharyngeal mucosal space, we have the retropharyngeal space, and deeper to the the deep layer of the deep cervical fascia, we have the space called as a prevertebral space. So we have a prevertebral space here, and outside the prevertebral space, that is anterior to the prevertebral space and posterior to the pharyngeal mucosal space, in between these two we have the retropharyngeal space. Now in between the retropharyngeal and the prevertebral space, we have a potential space called as the dead space. It's called as the dead space. Now if you see the prevertebral, we have the retropharyngeal space, posterior to that is the dead space, and the posterior to that is the prevertebral space. Now the retropharyngeal space extends up to T3 level, even the dead space extends up to the T3 level, whereas the prevertebral space extends till the thorax. Now this space, which is immediately lateral to the pharyngeal mucosal space, is the parapharyngeal space, excluding the carotid space. This inside the carotid sheath, whatever the space is called as a carotid space, and other than that, whatever the lateral fat we can see here, yellow colored area, this is called as a parapharyngeal space, and this parapharyngeal space contains only fat. It contains only fat. Sometimes small minor salivary gland rests might be present here, which might lead to salivary gland tumors at this region. Other than that, this area usually contains only fat. So that is the parapharyngeal space, and the one just posterior to the parapharyngeal space is the carotid space. It's composed of carotid sheath. Now prevertebral space again divided into prevertebral component of prevertebral space and the paravertebral component of the prevertebral space, and both of these are separated by a layer of fascia that we can see here. Whatever is anterior is called as a prevertebral component of the prevertebral space, and whatever the posteriorly is called as a paravertebral component of the prevertebral space. So these are the spaces that we can see in the suprahyoid region of the neck. Now it is important to note that the parapharyngeal space, the parotid space, and the masticator space are the three spaces which are confined only to the suprahyoid region. So these three spaces are confined only to the suprahyoid region, that is the parapharyngeal space, the masticator space, and the parotid space. These are the three spaces which are confined only to the suprahyoid region, whereas whereas the carotid space, the pharyngeal mucosal space, the prevertebral space, the retropharyngeal space, and the dead space all extends inferiorly to the infrahyoid spaces as well. Now if are seen even in the infrahyoid spaces. Now the superior extent of all the suprahyoid spaces will extend up to the skull base, whereas the inferior extent depends on how long they extend. When we approach any suprahyoid neck space, the one important structure that we note here is this parapharyngeal space, which is made up of fat. Now whenever there is any tumor which is arising deeper to this, that is from the pharyngeal mucosal space. Now the pharyngeal mucosal space is made up of the mucosa, then it contains the tonsils. It can be the palatine tonsil, it can be lingual tonsil, anterior and posterior pillars of the tonsils, and it also contains the minor salivary glands there. So any tumor from this area, or it can also contains the lymphoma because of the lymphatic tissue which is present here. So if it is arising from this region, it usually pushes the parapharyngeal space laterally. Now if the lesion is arising from the the masticator space. The masticator space is made up of the masticator muscle, then there is mandible, then also it includes the temporomandibular joint and the zygomatic arch, and also here the cranial nerve 5, that is the mandibular branch of the trigeminal nerve, also lies within this space, that is the masticator space. So any lesions from here usually pushes the parapharyngeal space slightly to posterolateral aspect, and if you see any parotid lesions will push the parapharyngeal space more medially, and if you see the retropharyngeal space, any lesions will push the parapharyngeal space more anterolaterally, and that's what we can see even in the imaging findings. And also we have this carotid space. Now carotid space usually contains the seventh cranial sorry carotid space usually contains the ninth cranial nerve, the 10th cranial nerve, the 11th cranial nerve, internal carotid artery, and the internal jugular vein. So all of this can lead to different lesions, which again can push the parapharyngeal space more anteriorly. So these are the changes that we see whenever the different spaces are involved in the suprahyoid region. This is a CT image which is showing the suprahyoid neck spaces. If you see, this is the mandible, and if you see that outside the mandible we have the masseter, and inside we have this temporalis muscle, and from the lateral surface of the lateral pterygoid plate we have the lateral pterygoid muscle, and from the medial we have the medial pterygoid muscle, and same thing is seen on the contralateral side. And here is the pharyngeal mucosal space made up of the mucosal surface of the nasopharynx. Now if you see here two contrast filled structures, we can see here the smaller one is the artery, the larger one is the jugular vein, and here the dense structure we can see this is nothing but the styloid process. These are the structures that we see, and we can see this black area here. This black area is nothing but the black is same as the subcutaneous fat. This is nothing but the fat, and this area which is present lateral to the pharyngeal mucosal space containing fat, this is our parapharyngeal space, which will help us to localize any lesion based on the displacement. If in case the lesion has arisen from the pharyngeal mucosal space, the fat would have displaced outwards. If the lesion would have arisen from the the masticator space, then the fat would have displaced more medially. So based on this displacement of fat, we can localize different lesions in the suprahyoid neck. This is again a coronal image which is showing the suprahyoid neck spaces. Mainly we can see here the masticator space extending all the way to skull base, and we can see here the mandibular nerve which is coming out of the foramen ovale, which is present in the masticator space, and also we can see how the zygomatic arch, the mandible, and also usually the temporomandibular joint which is formed at one end, the posterior end of the zygomatic arch, where the mandible meets the condylar fossa, which is just inferior to the external auditory canal. So that is the masticator space, and then if you see just outside the masticator space, we can see some extension of the parotid space, and the both parotid space and the parapharyngeal space, this is the parapharyngeal space medial to the masticator space and lateral to the pharyngeal mucosal space is what we have here. The parapharyngeal space on either side. Now both of them extend inferiorly, they will extend into the submandibular space. So this is again the image which is showing the suprahyoid neck spaces. So this is a sagittal image which is showing us the neck spaces which are extending from the suprahyoid region to infrahyoid region. Now if you see these spaces, that is the pre-vertebral space, the retropharyngeal space and the pharyngeal mucosal space, all three spaces extend below into the infrahyoid region, and surrounding this, the outermost layer, the innermost layer is the prevertebral space, and it is covered by a layer which is formed by the deep layer of the deep cervical fascia, and outside this we have the middle layer of the deep cervical fascia, which covers the structures including the thyroid gland, then the trachea, esophagus, including the thyroid gland. So this structure is the visceral fascia, or the middle layer of the deep cervical fascia, and outside we have the superficial layer of the deep cervical fascia. And this image again tells us that these are the neck spaces which extends both suprahyoid as well as the infrahyoid. Somewhere at this level we have the hyoid here. Now we can see the space is extended above it as well as the below it. Now the submandibular space, which is a space which is present in the both the spaces, not confined to any one space again. So these are the spaces which are extending both suprahyoid as well as the infrahyoid neck. So this is about the suprahyoid neck spaces.